Hi, I'm Dr. Tony Mork, endoscopic spine specialist. Today, I'd like to talk about cervical facet syndrome. This is part one of a two-part series. Part one of this video is going to talk about the problem, why you feel the pain that you do, as well as what the anatomy and function of the facets are in the cervical spine. Part two is going to focus on the treatment options you have, and why the current and most common treatment method of a rhizotomy is always temporary, and why there is another treatment that actually will work permanently for your cervical facet syndrome. All right, let's get started with part one. And remember, there are two parts to this. Well, here we go with facet syndrome, cervical spine treated with the laser. This is going to be a two-part presentation, since there's quite a bit of material to cover. In part one, we're going to talk about the problem. What actually is the problem? Well, let's start with the purpose of the facets. We're going to talk about the anatomy. We're going to talk about the symptoms of facet syndrome. We're going to show a cervical MRI and what you can see there. And then how do we prove that the neck pain or the headaches are from the facets? In part two, there'll be a separate video, and we're going to talk about the treatment, including the 4 treatment options, the problem with traditional rhizotomy. We're going to show a little endoscopic laser surgery clip, and we're going to interview someone the day after their surgery. Well, first, let's talk about the purpose of the facet joints in the cervical spine. Well, it's really to control motion, but it's also to weight bear. In this particular case, you can see the facet joints in the back, and they are in contact with one another as a result of gravity. So your head weighs 8 to 10 pounds, and the effect of gravity will actually compress the facet joints, as you can see here. Well, they also act as a primary control of motion. Number one, by the muscles and tendons, which are the active controls, and number two, by capsules and ligaments of the facet joints, which are passive restraints. In other words, the muscles can act to do something actively, but in case the muscles can't control it, the next level of control of this joint is by the thick capsule that surrounds the facet joint. Well, let's talk about the secondary control of motion, and that's actually the bone of the facet joint. So if you go past the muscles in terms of control, if you tear the capsule, for example, the next stop, the bony stop, is actually the facet joint or the bone itself, which is comprised of the descending facet as well as the ascending facet, and they look like kind of like roof shingles on each other. Well, what about normal range of motion? We can see that the vertebral bodies kind of rock forward and backward on the soft cushion of the disc, and we can see that the facet joints in the back guide this motion in a very complex way. So whether you're flexing your neck or extending your neck or turning your neck to the side, the facet joint will act on the back to restrain and contain that motion. Well, what is cervical facet syndrome? And what do you feel when you kind of have cervical facet syndrome? Well, you're going to feel pain on the back of your neck, usually a little off to the sides, and frequently accompanied by headaches. These are what they call occipital headaches, or pain in the back of the skull, kind of running up the back of your head, as opposed to something feeling in the forehead area or the temporal area. These are usually in the back of the head. So you will feel pain with extension. Notice if you tip your head backward and look up at the ceiling, that compresses the facet joints, and you might also feel pain at the end of the range of motion, or just generalized stiffness of the neck with restricted range of motion. Here we can see paraspinous pain is pain a little off to the sides, and you can see that it's directly related to the facet joint location. The occipital or posterior headaches are actually called cervicogenic because they are actually generated by problems in the cervical spine, giving rise to a headache in the back of the head. Well, what are some of the causes of facet pain? Well, certainly one is trauma, and you can see acute whiplash here would be an example. Looking at the car here, you can see the amount of impact that the person inside the vehicle would be experiencing. You can see that you have a head that weighs 8 to 10 pounds. It's going to be moving, it's going to be decelerating very quickly on an impact in this particular situation. So whiplash is comprised of complex forces depending on where the vehicle is struck and which way your head moves. But the upshot of it is that multiple soft tissues can be injured, and this is why it's so difficult. You can have ligaments injured, capsule injured of the facet joints. The facets can be injured. The disc and the annulus, which covers the disc, can also be injured in a whiplash type of a scenario. Well, remember, we looked at normal motion where the vertebral bodies rock back and forth on a kind of a spongy or kind of a disc that's soft and mobile, and the facets restraining the motion on the backside. Abnormal motion would be an example where you can see the first arrow is the spinous processes, and maybe the ligaments get torn off the actual tips of the spinous processes. The facet joints in the middle are pulled away, so the capsule's been ruptured, and we can see on the arrow on the far right that if we pull the vertebral bodies far enough apart, that the annulus is going to be torn away from the bone, and the disc can be injured as well. Well, what are the causes of facet pain? Well, we've talked about trauma, but the other cause is wear and tear. So wear and tear comes from three sources: gravity, muscle tension, and just general overuse. The forces of gravity are, of course, well understood. It's just your head weighs 8 to 10 pounds. This is being applied to constantly across the vertebral bodies, and the disc in the process just ends up getting compressed and maybe even protruding out to the sides a little bit. When the disc collapses, this actually makes the facet joints in the back get off center. So as the discs go, so go the facets. So loss of the facet joint space will accompany the loss of the disc space. So we can see on the top how the normal alignment, and this is the angle of the facet joints. If we lose the disc space, of course, number one, they lose their alignment, but two, they also are rubbing harder on each other, giving rise to degenerative type of changes. It forces the muscles also act to collapse. The muscles have to hold the neck together, and as a result, they're always pulling a little bit on the neck as well and compressing the facet joints. So loss of the facet joint space is from loss of alignment, and it can occur from overwork as well. So here we see on the top arrow, we see narrowing of the facet joint as compared to the facet joint below it. This is a fusion, so the facet joint associated with the lower arrow is wide open. It's held open by the hardware. But the problem with adjacent disc disease is that the segments of spine that are not fused are going to overwork to compensate for the areas that are fused. The motion's going to occur somewhere, and it's going to wear out the other areas prematurely, as you can see in the top arrow. Degenerative changes can affect the alignment of the facet joints in a term that's called subluxation. That's refers to the alignment and the alignment of the facet joints. If the vertebrae moves forward a little bit, the facet joints can also be out of alignment and referred to as subluxation. Well, what's the bottom line of degeneration? Certainly inflammation. You can get spurs and osteophytes, as well as debris building up inside the joint. Also, pinching of the soft tissues is a very distinct possibility. As you can imagine, The capsule of the facet joint, when it gets out of alignment, is subject to getting pinched. So we talked about inflammation, spurs, debris, and pinching, all leading to the possibility of pain. Again, the paraspinous pain to the sides of the neck, and we have pain that then can be generated occipital headaches or cervicogenic headaches occurring in the back of the skull. And what nerves cause all this facet pain anyway? Well, the sensory nerves from the medial branches. If we look at the sensory nerves, we can see that they're going to be going to the facet joint capsule. And here we see a picture where there's the vertebrae of the cervical spine. We see the spinal cord, the facet joints, the medial branches, and then you can see the small little branches at the end all going into the facet joints. Well, what does the MRI show with facet syndrome? Well, simply not much. There's nothing diagnostic about the MRI scan. So if you're trying to diagnose it, the MRI is not a good study to do. How do we diagnose cervical facet syndrome? Well, facet blocks, I think, are the most successful. You inject the facet joint with some kind of one of the canes, usually a longer-acting. Novocaine is short-acting, but commonly understood. Bupivacaine is a longer-acting anesthetic, and that's probably what I would use. You need fluoroscopic X-ray to do this particular injection. So here's an example of a needle into the facet joint, and this is just a couple drops, a small amount, half a cc maybe in the joint, and then the needle's withdrawn and maybe put into another joint. So how much relief should you expect? I think that you should get at least 80% relief, which then confirms the diagnosis of the neck pain being related to the facet joints. If you have 80% relief, I think that you can confirm the fact that you have facet syndrome of the cervical spine. And before we come to the end of the problem, I want to ask you a question. If you have cervical facet syndrome, what are your options for pain relief? There are 4 treatment options. So discover the treatment options in Part 2, Treatment of Cervical Facet Syndrome. Thank you very much for watching. Hope you enjoyed this, and just look for Part 2, Cervical Facet Syndrome, the treatment. Thanks. Thanks for watching Part 1. I hope you understand more about cervical facet syndrome, about the anatomy of the facets, and why they can hurt you, give you pain up and down the sides of your head, as well as giving you headaches. Stay tuned for Part 2. Here we're going to look at a unique way to use the laser to cure your neck pain from cervical facet syndrome rather than just manage it with rhizotomy, which is always temporary. If you'd like to know more about painful conditions of the spine, please subscribe to my channel. And if you've got specific questions here, just go ahead and look at my website, or else give the office a call and we'll see if we can answer your question. Thanks for watching.